Hi, I'm Dr. Datis, Kharrazian, and if you're a healthcare clinician, I think you're seeing a growing incidence of depression, chronic fatigue, childhood developmental disorders, cognitive decline, neurodegenerative disease in your practice. And this is a growing epidemic, and we have really a worldwide issue with reduced brain function and brain inflammation and various things that are really impacting how our brains operate today in modern society. Many of these things are related to our environment and our foods and many of the things that we do with our diet and lifestyle, and these things can then impact our brain and how they function, and then these lead to clinical presentations that many practitioners see that are common for everyday chief complaints, such as just getting tired whenever they're having to use any kind of cognitive task, or can't think, can't focus, can't do their daily activities. One of the things that we do know is that when individuals do have these symptoms, that there has to be a very good clinical understanding of the brain and how to support the brain. And this is beyond just taking fish oils or some kind of basic neurotransmitter amino acid product. You have to really understand the key concepts. And one of the key concepts to really understand is this concept of neuroinflammation, brain inflammation. And I think most people have a very superficial level of understanding of neuroinflammation, because in recent years there's been a growing explosion of research on neuroinflammation. So the key thing to understand about neuroinflammation in the brain is that the brain has two types of cells. One are neurons and the other cells are glial cells, or neuroglial cells. And these neuroglial cells operate completely different than immune cells in the rest of the brain. Now, our glial cells are there to protect us. They help deal with infections if we ever have an infiltration in our brain. But more importantly, what they do is they get in there and they clean up debris, and they help keep our immune system in our brain healthy, and it helps fight off not only infections, but it also gets rid of plaques, and it fine prunes or little synapses that are involved with healthy neurological function. So the glial cells were something that were discovered 100 years ago. When they first discovered them, they thought, well, these are just glue cells. They're just keeping neurons together. They call them glial cells. And then 50 years ago, what they discovered was, well, these are not just glue cells. These are immune cells, and they have lots of important functions for the brain of controlling inflammation and really getting rid of debris in the brain. And then recently, there's been another major breakthrough. And what they found is that these glial cells, and there's different types of glial cells, but for example, cells like astrocytes, they're actually important for cognition and memory, and they're really important for us for getting rid of things like glutamine and glutamate in the synaptic cleft, and helping basic homeostasis of the neuron, and really making sure synapses happen properly, and they're really gatekeepers of the whole neurological integration function. Now, there's some really important things to know about these neuroglial cells. One is we only have a limited amount of them. So about 15 to 70% of our brain cells are neuroglial cells. And the key thing is with them, they're vulnerable to oxidative stress, and they're vulnerable to inflammation. So over time, as we get older, we lose our glial cells. And once we lose our glial cells, we're unable to get rid of plaquing, like beta amyloid plaques or tangles, and this can lead to things like Alzheimer's disease or other types of neurodegenerative disease like Parkinson's disease, where this protein alpha-synuclein just builds up in the brain. It's not able to be cleared by these microglial cells. So these glial cells are essentially critical for us to maintain throughout our life, and there's many things that can really degenerate glial cells, just like many things can degenerate neurons. But once they go, we're in trouble. And once they go, there's no going back. And then if a person loses enough glial cells, they're on their way for sure to significant neurodegenerative diseases. Now, unrelated to these glial cells and how vital and important they are, these glial cells also have major functions in how we protect our brain. So these glial cells have the ability to turn on to an inflammatory response, like a soldier of the brain, or they can really function as neurons support group for building homeostasis. So in a normal healthy brain, these glial cells are there, they're getting rid of debris, they're getting rid of synapses, and then at some point, if these glial cells get turned on, for example, a traumatic brain injury can turn them on, or HbA1c for diabetes or oxidative stress can turn these on. Once these glial cells turn on, they stop really working as a cell involved with neuron synaptic homeostasis, and they actually change their shape, and then they become a soldier. And once they become a soldier of the immune system, they're no longer regulating homeostasis, and they're fighting for this inflammatory response. So one of the things that we see is we have many patients, many people that really have their glial cells turned on to an inflammatory state, and they're no longer able to have these important cells of the brain really control their brain homeostasis. They have diverse neurological symptoms. I mean, the most common symptom people have when these glial cells don't work is brain fog, inability to focus, inability to concentrate, and then this progresses into significant cognitive decline and depression. Those are the key factors there. And what they're also finding is most of the research being done today on depression is really finding that the antidepressant model is really failing most patients with depressions at a very high rate. Like almost 80 to 90% of people do not benefit from antidepressants, especially after several weeks. So the model is really shifting to an inflammatory model, because when the brain's inflamed, the brain doesn't fire and neurochemicals get disrupted, and that's really the key underlying issue. Now, when you look at these glial cells, not only do they have this ability to either regulate homeostasis or switch into a soldier and really be on guard all the time, but these glial cells have different immune responses. So one of them is called an M1 response. An M1 response is inflammatory and destructive, and we need that. We need that to get rid of plaques, but we don't need it to be overactive. Then there's an M2 response with these glial cells. They get primed into one way or the other, and that's really protective for us. They help block inflammation, they help neurons grow, they help release glial line derived neurotropic factor to help with synapses, and they really keep our brain healthy. Now, the things that we do in our life, diet, nutrition, lifestyle, all these various factors can totally impact how our glial cells work and whether they switch from an M1 to an M2 response. So one of the things that I'm going to be doing when I teach my course on neuroinflammation is really teach people all the physiology behind microglial cells. I really want to teach you the concept of what dietary, nutrition, lifestyle things switch M1 to M2 cells, what happens when glial cells shift into an activated immune soldier. And then the other thing I really want to go over with you is really how you deal with what's called glial cell priming. Another key concept that is really important for you to understand is that when glial cells get activated and primed, they're ready to go. They're inflamed, and anything trivial can aggravate them. So in a very advanced clinical model, what I will teach you is once you see a glial cell activation and a person has neuroinflammation, how do you work backwards? What are all the things that turn on brain inflammation? So it could be looking at complement activation and looking at biomarkers like C3 complement proteins in a blood test. It could be looking at markers like HbA1c that can turn on microglia. Lack of activation turns on microglia. Traumatic brain injuries turn on microglia. Hypoxia turns on microglia. So I'll teach you a step-by-step approach how to really work your way backwards and how to figure these mechanisms out. I can tell you that treating neuroinflammation in a clinical model is more than just taking some natural flavonoids that are anti-inflammatory or just doing some probiotics or trying to fix the gut to impact brain through an anti-inflammatory model. It is much more complicated, and it really requires a systematic model. So the past few years I've really spent a lot of time reading all the major papers and creating a clinical model for my own patients and for my own practice where I have to really figure out ways to dampen this neuroinflammatory cascade. So I'm very excited to share all this new research and this new clinical model with you. I am convinced and absolutely certain it will dramatically change how you practice and see and work with your chronic patients. So thank you, and hope to see you in our program.